interesting that good that we are all saying the same things, though we're all saying the same things about system integration being the right thing to do. Actually, the truth of the matter is it's horrendously complicated, and actually where you start to change systems, I think, is very difficult. So I'll tell you a bit about how BHR are addressing that and how far we've got. The other thing to say is that in BHR we already had lots of bits and pieces going on, so we were already a vanguard for urgent and emergency care, Prime Minister Challenge Fund for primary care. We had lots of programmes already in place to try to keep people out of hospital, get them out as soon as we could. And so what we're trying to do, in a way, is sort of throw all of those up in the air and say, okay, but we need to do much better than that to meet the challenges that we've got. So at the moment we've got all the pieces that we used to have in place still rolling on, but we've got hold of them all, thrown them all up in the air, and we're trying to be much more ambitious and come up with a much more far-reaching programme. So I know some of you won't be able to see these slides. It really is just a nice little infographic about all the healthcare issues and challenges that there are in BHR. And you can summarise it by saying there's quite a lot of poor health. It varies across the 3 boroughs that are working together. A lot of people not doing the right thing to look after themselves, and far too many using acute services, expensive acute services, and far too little primary and secondary and integrated care going on. We've got care quality challenges. Our acute hospital is in special measures, and probably some of you can see that big 400 million at the bottom, which means we're also broke. So that's the sort of burning platform that we're up against. And I think what we have got in place are the assets of very strong leadership. We've also got very strong leadership from the leaders of the 3 councils, which is really, really important, because I think people have talked already about this being about whole population change and community change, and it's great that they're on board. So just taking you through to a few more of the details. Obviously, what we have been analysing is the things that need to change. So we've got lots of whole community and healthcare solutions we need to work on, mental health, physical activity, falls, housing, education, smoking. We also know from an analysis of all that research that we heard about before our break that we've got lots of clinical pathways that aren't in the right place at the moment. So what's been going on is quite a lot of detailed work, not by me, in fact a lot of it led by Vicky, who's here, Vicky Hobart at the DPH from Redbridge, to actually try to crunch all of that together and say, so what are the priority programmes that would hit both the biggest improvements in the healthcare of people locally and also hit the money as well, because actually we need to do that. And we're slowly but surely getting to a prioritisation and costing of those interventions. But actually, critically, we need good delivery mechanisms as well, because we can have any kind of analysis we want of what the care pathway should be. If we can't deliver it, then that's no good either. So we have our GPs working on a more ambitious primary care programme, and we're also working with local government about experimenting how we can really bring systems together in neighbourhoods. We're trialling or about to trial in each of the boroughs something slightly different. In Havering, it will bring primary care together with council services around children and families, really trying to address some of those early integrations, some of the healthcare issues that face children and families in one of our areas, which currently delivers the largest number of looked after children and children at risk. So there's a real opportunity to cut into a lot of things, children's mental health, obesity, education, etc., etc. In Barking and Dagenham, the pilot will concentrate on employment. Barking and Dagenham has the highest level of deprivation and unemployment. Again, really experimenting around all those issues about employment being a major cause of ill health and mental ill health in particular. And in Redbridge, it's about integration of NELFT, our community partners foundation trust, with local social care services to actually try and get as much integration as possible through to primary care. So 3 propositions that try to bring all of that experimentation together. And what we need at the bottom, as you see, is a lot of strategic enablers. We're using that academic research the innovation unit. The innovation unit in Care City is really helping. A huge focus on workforce, and that has to link across and through to the STP, including in that we're saying actually housing for our workforce. So we want to work with local authorities about regeneration and housing models as well. So linked to strategic estates planning, much more community engagement, so we're engaging with the voluntary and community sector and have done a big survey of our population and what they feel they want. And on top of all of that, we're trying to work out the mechanisms that you'd need to have in place if you pull all the money together and behave as if we're one big organisation, not all the many that we are at the moment. So that's just a flavour of what we're doing. And the last slide was just saying, ideally, we will get to a place where we've got localities and hubs working seamlessly together. Thank you.